Thank you everyone for joining. I do see some people jumping in. We will be getting started shortly.
Maybe as we wait until we get started, folks can share with us, those folks that have joined, if you can if we can have a quick introduction, if we can make a note of who is on. Thank you.
Hi, this is Rosie Arroyo with the California Community Foundation.
Dennis Camille with the Immigrant Affairs Office of Garcetti.
Joyce Ibarra with the Weingart Foundation.
Taryn Forge, CHIRLA board member.
Chrislyn Bronner with Dr. Bronner's Family Foundation.
Tom Blazer with the Four Freedoms Fund.
Thank you so much for joining. I would say let's give it just one more minute so we can give folks a chance to hop on before we get started. Okay, good morning, everybody. My name is Aurora Colindres. I am the Director of Development here at CHIRLA, the Coalition for Humane Immigrant Rights. Thank you to everyone joining us this morning. We have invited both existing, past, and potential supporters from philanthropy and otherwise, as well as just longtime friends to provide you this update. Some quick notes for everyone to know as folks are joining the webinar, our live webinar today. Everyone will be automatically muted. Any questions or comments, we're asking that they be held until the end, or that you provide those questions in the chat box for us to follow up on the question and answer section at the end. Also want to let you know that this session is being recorded. So your video will not come into play, but all the audio will, so that we're able to share it with folks that are not able to join us this morning. We just want to remind you again that if there's anything that is needed, or if you're having any technical difficulties, please let us know in the chat box. So again, thank you so much for joining us. First thing we want to do, of course, is to send well wishes to all of you, to your teams and to your families in this time of incredible uncertainty and crisis. We want to just extend our gratitude for all the support that we have received from your foundations and different entities throughout the years. That has allowed us, we feel, to have a really strong response at this time for one of the more vulnerable populations, of course, being immigrant communities. So we'll get right into it. We have quite a bit to share. We'll be following along with the PowerPoint. So I'm going to turn it over to Angelica Salas, our Executive Director, for her update for all of you. Thank you.
Sure. Well, first of all, thank you so very much for all of you for joining us, and thank you for your countless years of support to CHIRLA and really to stand with us at this moment. I wanted to first begin by talking to you about how we are doing as an organization and how we are moving forward in order to serve our community. It is very important for me to let you know that our operations at this moment have all transferred to a virtual nature. All our CHIRLA offices, all 11 offices are all working remotely. As you all know, we have satellite offices throughout the state of California, in Sacramento, as well as in Washington, D.C. So we are continuing to do the work, but we're doing that remotely. We had canvassers out in the community. We had a call center running. You'll hear more about that today, but we have been able with our IT department to work together in order for all our services to now be done with our community online. We all have also put our hotline up again. I mean, we run an immigrant assistance hotline throughout the year. This immigrant assistance hotline is also being answered remotely. Our hotline runs Monday through Friday. Its number is 888-624-4752. We'll send you some of those materials later, but we've been receiving countless of calls through our hotline, and it too is running remotely. And then finally, we also at this moment have done all our legal services remotely. So we have virtual legal appointments on Tuesdays and Thursdays. We have upgraded our Zoom capacity so that the services that we're offering immigrants through our virtual legal appointments are also confidential and secure from any intrusion. And so you'll hear more today about this from our Director of Legal Services, Luis Perez. I also wanted to talk a little bit now about what we're seeing in terms of CHIRLA's COVID-19 response. We knew right away that in a pandemic, in a healthcare crisis, our immigrant community was going to was really one of the most vulnerable communities, but that we needed to be ready to respond to their needs and to advocate in order to ensure that our community was paid attention to. We knew that individuals were going to have questions about accessing government services, and these are the same questions that people have every year, every day. In terms of just accessing health services and other safety net programs, especially in light of public charge, but that this was going to be heightened and that we needed to be ready. We knew that many of the individuals that we would be talking to were not eligible for certain healthcare and other access programs, so that too necessitated our quick response in order to inform our government officials and also our health officials. We recognize that a lot of the materials that were being sent out, as well as the on television public announcements, were actually only being done in English, and that a lot of people were going to be having a lot of questions. And we're very thankful to some of our government leaders that have actually transitioned into actually also doing full announcements either in Spanish and then translating them into different languages. But early on, that was not the case. On the first day of our quarantine, CHIRLA responded to immigration enforcement here in Los Angeles and have been responding to issues of detention, and our attorneys continue to have to present themselves at court in order to represent their clients. So we've made some adjustments in that regards, but this continues. We're also in the middle of all this preparing for a DACA decision in terms of the Supreme Court moving forward in a decision. So we've been advocating with our partners at a national level to delay that decision, but independent of that, we're preparing in terms of really how are we going to respond when that decision comes forward. So we have a whole campaign and operation responding to documented individuals, including pushing for continued renewals. Our community is calling us, and you'll hear more about that, about the fact that they're losing jobs. So mothers, fathers, both losing their jobs, and are just in such precarious situations because they do not have access to unemployment benefits. And then the last piece is that our community has been left out of the stimulus fund. And I think our last point here was supposed to be about our stimulus plan, so I'll correct that error. But I want to just leave us with a couple of points. Californians and our country's immigrants have contributed to the revitalization of our state, of our cities, of our rural communities. They contribute significantly to the tax base and to a myriad in a myriad of ways, and independent of all their different statuses. California's immigrants are 26.8% of the population, 10.6 million strong. They're paying $119 billion in taxes, and they're injecting into the economy $290 billion with their spending power. Immigrants pay $38.9 billion in state taxes every year. There are 2.5 million undocumented immigrants in California. They represent 91.6% of the nation's share of working age undocumented adults. Undocumented immigrants are paying $2.5 billion to California taxes, $4.5 billion to federal taxes, and $46.5 billion in spending power. Nurses who are foreign-born in California are 35.7%. Health aides who are foreign-born are 45.5%. Documented individuals at 269,000 also represent 93.9% of working age adults who are DACA. And then finally, they're paying $1.5 billion in taxes, and to California, $603 million in taxes. Why am I saying all of these numbers? Because it is unfair, it is immoral for us to now not have immigrants included in the stimulus package or in any other relief package for our community. So what CHIRLA has been doing, and what you'll hear more about, is responding to the immediate needs of our community, but also saying it is critical that they be included in the safety net programs, that they be included in unemployment benefits, and that we recognize that in this moment they have to be treated like everybody else, which are individuals who are dealing with a health crisis, and that they're being impacted in a way, and we all have to be paying attention to that. With that, I'm going to pass it along to my colleagues who will be speaking about how they're responding and what our community is directly saying. And I think our next presenter is our director, our political director, Diana Colli.
Thank you, Angelica. Hi, everyone. Good morning. And I think you'll see right now on your screen the results of a survey we put together with our CHIRLA members across the state. But before we get to that, I actually want to report back on the census work that we've been doing. Our campaign started last April in 2019. And right after the March primary, the goal was to take a few days off and continue with the momentum that we had been building with the teams we had on the ground, and get into the questionnaire assistance center phase of the campaign. And so a few things had to change. We have our census campaign runs across the state, all the way from Davis to Sacramento, the Central Valley, Antelope Valley, San Fernando Valley, Orange County, and the San Bernardino area. And what we were faced with two things. One was, trying to keep everyone safe, we had a huge team of canvassers at the door. We had 54 canvassers at the door and 15 phone bankers. And so how do we keep up the urgency of the census in these hard to count communities where we were knocking on doors, by keeping our canvassers safe and still giving the information out. And again, one more thing, and I don't think enough people talk about it, is and making sure that, we were still able to pay the canvassers, because we felt when debriefing with them, a lot of them were in households and families where somebody in their family, somebody in their household had already been laid off. And so we knew that these checks coming from the campaign, it's their livelihood. And so it took us a while to try to figure out, and by a while I mean a day or two, to figure out and get creative on how we were going to make sure the word was getting out, make sure our communities were filling out the census, and that these people still had a job. And so we were able to do some changes. Again, like Angelica said, everybody was working remotely. Our call center operation, which I think a lot of you have visited at the CHIRLA headquarter office, a beautiful room full of computers and phone bankers. We had to make sure that all 15 of them were able to transfer and take, since they were familiar with the program, to be able to do that from home. In addition to that, we had to put our canvassers, which did not have as a requirement to own a computer or be able to phone bank, into a virtual phone banking system. And so now we have 2 different sets of groups, our call center operation, who's identifying and committing people to the census, and then we have our canvassers. And out of the 54, we're happy to announce that 53 of them were able to jump on the virtual phone bank from their home and keep with the campaign. They're calling voters and CHIRLA members and CHIRLA legal clients on the census and actually walking them through every question in the census questionnaire form. And when they feel confident enough and have all the information, they're transferring them to the Census Bureau so that they can get help in their language. So just wanted to update on that. One thing that we decided to do right away is ask the people, our members that we were calling, because that's the first list we started with, ask them how they were going to get impacted by the coronavirus. And I think that was our way of seeing what policies did we have to prioritize in the local, state, and federal level by the results that we were receiving. And you see the numbers on the screen. The number one concern was people's ability to pay rent or pay the bills next month, which is technically tomorrow. People do not have savings and they were concerned for that. The second one was that they were worried that they would get reduced hours or would be laid off. And then the third one was that they felt that they had someone living in their home that was at risk. In addition to this, I would also add, and it was just feedback that we would get from the conversations. A lot of them, and I would say this is one of the top 3 concerns, was that even though they are undocumented, they are working what's considered an essential job. So essential and undocumented and uninsured. And so to us, that raised a huge flag onto what's next for our community. We are continuing these surveys, and I wouldn't even say continuing these conversations with our very active members. And so our organizing department has taken on like the next step of that to dive into, I think it's like about 12 question conversation about the specific needs that they need as undocumented. Remember, our members, I would say, either are undocumented or come from mixed status families, are active with us year round. And so we're working very close with them to identify where do they most need support and what do we prioritize. And I think my time is up. I don't know who's next, so I'm going to hand it over to the facilitator, and we'll take questions at the end.
Thank you so much, Diana. Thank you so much. Up next, we will hear from Miriam Mesa, our Director of Community Education and Outreach, with regards to a little bit more about what we're hearing directly from the community. Go ahead, Miriam.
Yes, good morning, everyone, and thank you for joining us. I would like to start by saying that our department have been able to move all the work towards online services, including our hotline that it's functioning Monday through Friday, 9 to 5 as usual. We know that these are times of need and that our immigrant community is the most vulnerable population right now, as you know, in these times of crisis. They are in total desperate of need of information for sources from places that they trust, because there's a lot of information out there, but the community might not feel comfortable with, and they sure trust the organization, and that's why we are moving full force and trying to educate them as much as we can. We're being creative and trying to implement new systems that help us educate the masses and bring as much information as we can to our community. We pivoted everything to online working, and the hotline, it's also being run from home. Like I mentioned before, our staff is constantly receiving calls. They have received a total of almost 300 calls in 1 week, which is a pretty sizable number, and they have been relaying to me all the information and all the concerns that we get from the community. And the number one concern the community is having right now is, of course, how to pay the rent. There's many families out there that both parents have been laid off at work, and those families are in great need of resources. And also, as a response to this need, we were able to create and develop educational documents that will be shared probably later on here. These documents are pretty comprehensive. They include all many resources that have been that are available to the community and in this time of crisis, but also other resources that they could tap into. And we are constantly updating all these documents as we speak. Also, we have been pivoting towards offering or using our social media platforms. We are going to start a series of workshops that we're going to be doing online on Facebook, and it's going to be called CHIRLA en Casa. And we're going to have every week one of these workshops where we interact with communities and we answer their questions and we tend to their needs, because right now our community is in great need of knowing how to access healthcare, how to access testing, how to receive treatment, can they access financial resources to pay the rent for this upcoming month, even food assistance, and how to, places where they could go and go to a food bank, or where can they find a grab-and-go lunch center, or even the elderly community that it's so fragile. In these times, we're also having and offering resources for that particular population. So we are doing our biggest effort in bring as much possible resources and information to the community in this time of need. And that's how we are planning on continuing doing, right? We're also starting to offer webinars to share this information with our partners, our networks, but also reach out to the community at large and offer these webinars in particular for our members, for parents, and the community as a whole. So thank you very much, and probably you'll have access to the documents later on in the presentation at the end.
Thank you, Miriam. And yes, we did include some samples of some of the flyers and some of the materials that we are sharing with community that Miriam was referencing. Now we will turn it over to Joseph Villela, who is our Director of Policy. Joseph, get away.
Yeah, and thank you. Good morning to all for joining. So just to echo some of the comments by Angelica, one, just a reminder, obviously this virus is not just a public health issue, an emergency that has to be addressed immediately. It is also going to be an economic crisis, both at the federal, state, and local level. And that means that it's likely that our communities are the ones that are going to be, at the end, most likely, mostly affected by this crisis. As the COVID-19 continues to take a toll, we've been advocating at the local, state, and federal level that immigrant workers, one, should be protected, but then also any type of treatment and access to the long-term treatment, because we don't know at this point what will be the long-term effect in regards to health for those individuals that are infected with the virus, that is included regardless of immigration status at any level of government. In addition to that, one of the things that we started to do to really rally support for several of our requests is that early on, when we saw a potential response by the federal government and state and regional, we decided to put together a list of demands that at this point about 50 to 60 organizations have signed on to it, in which we lay out some of the recommendations that we wanted, from access to healthcare to the collection of data, which is something that is becoming very critical at all levels. And we're happy that, for instance, Senator Harris is moving forward with a letter with Senator Booker to trying to make sure that at the federal level, there's a collection of data around ethnicity and location of who's been affected. Without this data, both at the national and state level, we feel that resources will not be allocated to our communities. In addition to that, one of the things that, through that letter, one of the things that we wanted to make sure is that any type of relief, as Angelica mentioned, was also available to immigrants. Unfortunately, the relief that passed did not have some of those resources, but I do want to highlight a couple of things that were successful based on the advocacy that we did. One is in regards to the billions of dollars that are going to be allocated to community clinics. Those are the ones that are going to be treating our community, and those are the ones that we feel very optimistic as it relates to the treatment of our communities. And so that was a lot of the work that CHIRLA was part at the national level to make sure that that money was included. The other thing that we were very happy as it relates to the stimulus package is the money that states were going to get if they run into a deficit based on the response from this virus. This is very important, at least for us, when it comes to the budgeting, given the fact that the state is going to respond one way, but if we can get as much resources, both the state and the regional level, from the federal government to pay for that treatment or whatever resources were allocated, that means that we can utilize our state money and regional dollars to really provide a relief for immigrant communities, regardless of status. So we were very happy that $150 billion was allocated to for what they call the stabilization fund for states, something and we were happy, but it's not going to be enough for that. Lastly, there were about $350 billion that were allocated for small businesses, but also nonprofit organizations to ensure that they keep their workforce intact. I think I just want to highlight some of the success that we had, even though a big portion of things that we want were not included, such as the waivers for state to cover everyone regardless of status and make sure that that money or those resources will go back to the state, ensuring that people have access to the tax relief. And this is critical because the language was so narrow that it actually left out 5 million US citizens who are children and whose parents are undocumented. This is something that we are very concerned, given the fact that it could lead to a precedent of not providing economic relief to those children who are citizens, but whose parents are undocumented. So our hope is that that's something that we can fix in the future. The other thing that at least we were trying to figure out, how do we move forward, and through the work of Senator Harris, we were trying to get some answers, is what is the role of ICE during this pandemic? And so through the advocacy, we want to make sure that DHS and ICE directors are held accountable and that they get straight answers to us as it relates whether they're going to be halting enforcement and whether they could protect sensitive locations. A couple of highlights that we had, as I mentioned, just recently, for instance, we held a conference call with Senator Harris in which she went over some of the things that she worked with us, but then also she wanted to hear from immigrant rights advocates in California to make sure that in the next bill that will be introduced in the Senate or the House, that they include immigrants. And that's something that we are going to continue to do to re-educate elected officials at all levels, but also bring them to talk to our communities. And so to that end, tonight, Angelica is going to also be holding a conference call with Senator Mitchell in Spanish to really ensure that our communities are educated, and Senator Mitchell will become critical because she's the chair of the Senate Budget Committee, and so any relief that will come from the state, she will be critical in shepherd some of those resources at the state level. And so for us, we, as we look at the state to really respond to the lack of leadership at the federal level, we're going to be engaging leadership, and we're going to be moving proposals and educating elected officials to move those proposals to make sure that they expand current state programs for immigrants, because those are state dollars and they can do that, and at the same time draw money from the federal government to cover other expenses. At the regional level, one of the things that we also want to make sure is that all treatment is also free. And to that end, we were very happy that LA County has been very vocal in indicating that through My Health LA program, a program that we helped advocate several years ago, they're going to cover all the treatment and testing free, regardless of immigration status. And so our hope is that that continues to be publicized in different through ethnic media, but then also other platforms to make sure that our communities know and are not afraid to be tested if they need to. So I'll leave it there just because of time, and I'll be happy to answer any questions in the future.
Thank you so much, Joseph. Now we move on to our legal services update by Luis Perez, Director of Legal Services. Thank you.
Yes, good morning to all of you. And like you've already heard from our colleagues, a lot of the work that we do here at CHIRLA is very critical, including the community education, the census work, and some of the legal services that we just can't afford to wait because of deadlines or because of the Supreme Court decision that we're waiting, and removal defense, people getting deported in the midst of this crisis. So the legal department is still active, and we have to figure out a quick way to transition over to online services, but not everything that we do here can be done online, unfortunately. And even though USCIS has closed some of the offices, they're still processing things. They're still expecting us to meet deadlines. The detention centers have not closed. Adelanto, it's an example of something that needs to be addressed. It's very difficult to access clients. The judges there are not canceling hearings, so we still need to be ready and prepared to represent our clients, even though we don't have the access to prep them. And for those of you that are not familiar with our legal services here at CHIRLA, I'll explain a little bit about our department and then go into the different ways that we're adapting to this time. The legal department has 4 units. We have what we call the clinical unit. That's the unit that does our DACA and citizenship work. We have the family unit. That's where we do family petitions, adjustment of status, victim relief. That's the U visas, BAWA, and SIGIS, special juvenile immigrant status. And we also have the removal defense team. That's our downtown LA office, where we do a lot of the removal defense out of Adelanto, but also the immigration court in downtown LA. And we have the student legal services. That's a unit dedicated to working with Cal States and community colleges. Our staff is 54. We have 54 staff. There's a combination of 15 attorneys with paralegals, legal fellows, and legal assistants. And the 9 offices, out of the 11 offices that CHIRLA has, have legal services. And that includes our main office here in LA, San Fernando Valley, East LA, South LA, now Compton, South Orange County, Porterville, Sacramento, and Sonoma. And again, some of the things that we were really worried about was that there's been some announcements from USCIS and from the Supreme Court, but they didn't stop coming out with decisions. And we talked about the looming DACA decision. That's something we're really worried about because they're still going to decide. And now that they cancel all of their arguments, this decision may actually come sooner. So we wanted to find a way to really not stop our DACA services and quickly switch to a way by which we can continue to serve that population. So we took all of our staff, and instead of having local intake clinics, our DACA clinics, we now have a statewide online registration where we started with 30 people who registered the first day to 50 the second day, and now we're taking 60 people each time we have these clinics. These clinics are linked to registration are posted on Facebook and Instagram every Tuesday and Thursday at 8 a.m. and we keep it open until we fill to the capacity we're trying to reach. And that's actually happening in just minutes, always in less than an hour. We're meeting our quota for the day. So there's a huge demand, in part because a lot of other legal service providers have closed shop or are also limited or still doing things in person. So CHIRLA is one of the organizations that's finding a way to still help with that volume that meets the high demand for DACA services by doing this online. But it's also a challenge because now we're taking a service that we used to provide in 2 hours, now extending it over 3 days. 3 days that it takes now from intake to the paperwork to the finalizing and mailing out the application. So it is a challenge, but we're heading it, we're doing our best and increasing the amount of people we could help each time. Unfortunately, this is just for California residents because we have a little bit of funding from the state to help us pay for the application assistance, but also for USCIS fees. So we have been asked from people out of state that we're not able to help in order to streamline our process. But there's a demand for this type of service and this type of way of doing things right now. Again, so the link is available on Facebook and Instagram at 8 a.m. on Tuesdays and Thursdays, but it does get taken off once we fill our capacity. So sometimes people think that the link's not working. It is, but it's actually offline by the time they get to it. Our general consultations, we're actually working with our community education department, the hotline. Their staff is going through all the calls and they're getting hundreds, probably thousands of calls, but they go through all those calls and they refer to legal services. Anyone who needs a general consultation or a removal defense consultation. And then our staff has a list that our attorneys are actually calling these individuals from home to do those consultations over the phone and using Zoom when needed. Our removal defense team is still going to Adelanto, but we also, because it's difficult to get access to the detainees, we also put our phone number in the pro bono list at Adelanto. So now the detainees are able to call our offices and have a consultation over the phone so that doesn't stop. But again, a lot of judges have switched to in-camera hearings. That means that they could do it over the phone or some sort of Zoom system, but that work's still moving forward. And unfortunately is the most impacted service for us because we're not able to meet the volume that we want to under the circumstances. And the student legal services, again, the work with the students at the Cal States in Sacramento and the community colleges here in Orange County and in Los Angeles, we have certain requirements that's why we have to purchase the new Zoom accounts with the encrypted added security to be able to comply both with our contract, but continue to do the work of helping the students from community colleges and Cal States. But again, this is still moving. A lot of things are still changing and we're always working to improve our systems to help as many people as we can. So I'll leave it at that and I'll be happy to answer any questions about our services, about how to access them or how to refer people to us that need emergency services because of losing access to whatever they were used to and before. But we're here in the offices. Our staff still has to come into the office to package the application, to mail it out. And as long as the post office is working, we're going to continue to do our work and continue to submit applications. We'd like to time it so that we submit applications the Friday before any DACA decision day. So we actually try to do everything between Monday and Thursday, and Friday just use it to package and mail things out. And just in case there's a Monday decision, all those people would already be mailed out and be part of that pool of people who are already part of the process. We don't know what the decision is going to be under DACA, but we're expecting the program to end. But we hope that people that have a work permit will continue to use that work permit until it expires. So we continue to promote to renew early, even if you have a whole year left for DACA, we are promoting that. But we're definitely prioritizing people whose DACA is going to expire in the next 3 months to make sure that they get submitted and hopefully approved before the decision comes out. So I'll leave it at that, and then I'll stick around for any questions. Thank you.
Thank you so much, Luis. And just to make it a little bit interactive before I go into my section, I did want to highlight something, of course, having to do with your section, but maybe some of the other directors can jump in and speak to it. And I think it's just the connection of the fear of deportation and sort of, you know, the activation of ICE and different activities that are still continuing to happen. Can you speak, because we have a few minutes, can you speak to that and just share with everyone what you're hearing? And of course, Miriam, you can jump in as well.
Right, and I mean, it's troubling that on the same day that a lot of cities and states are issuing stay-at-home regulations, that ICE comes out with an article in the LA Times showing how they're still continuing their enforcement operations here in Los Angeles. And we actually get those same calls from the people that got detained that were featured in the article. We are getting those calls from them because they have very few places to go because a lot of them are closed. So yeah, so it was an act by ICE and the LA Times to feature such a story at a time where people are afraid of the virus and losing their jobs and paying rent, but they also need to worry about ICE coming to their doors and having to still be on top of their civil and immigrant and their constitutional rights when they should be worried about finding out how they're going to pay rent and other things. So we've talked about it a lot here internally. Angelica might be able to share more about that as well. She's talked to other folks about this a lot. But it's unfortunate that immigrants need to be thinking as much about deportation than they have to think about the threat of the virus and their health.
The only thing that I would add is just that people need to know, I think America needs to know, that our detention centers are actually increasing in volume as opposed to releasing individuals, and that part of our advocacy work was to really align detention centers with what's happening in prisons across this country, and the fact that people are being released, that there's been a significant decrease in arrests, and that there's criterion around that. That's not what's happening at our immigration detention centers. And so we're part of the Defund Hate Coalition. We have been working a lot with our state officials to try to come up with creative remedies around this. So I've been working with Insurance Commissioner Lara, Senator Durazo. You'll hear more about some of those plans as we move forward, but also just really understanding that this is a health crisis and we need to respond. The other thing is that I want to speak to the safety of immigration attorneys in what they have to do at this moment. So if operations continue around removal issues, then they have to continue to operate. And we still have planes that are leaving our country, leaving California with deportees, and then bringing back in those planes U.S. citizens who are stuck in home countries. I wanted to actually maybe pass it to Miriam just about some of the concerns that people have about overstaying visas and some of those questions that you've received, and then I'll pass it back to Aurora in terms of moving forward in the Q&A as well. Miriam?
Yeah, yes, Angelica, I was actually getting ready to mention that through the hotline, we've been able to identify some pressing concerns that the community is having right now. And we have received calls of people expressing fear of that they might be forced to overstay their visas because, all the flight limitations due to the crisis of the coronavirus. And also other people are calling it relatives that are here in the country, but their loved ones went outside the country, they were traveling, and now they're stuck out there and they cannot come back. So that's a concern that we've been getting a lot through our hotline, and that just goes to show you how people really look up to the hotline for resources, right? But then also how we as an organization are able to highlight these issues on to try to find solutions through advocacy and pushing for some resolution to these problems. Also, it's worthwhile to mention, like Luis, I believe, mentioned at the very beginning, how on the same day that, safer at homes started to be implemented and people stayed home, this person was detained by ICE, and how the family members were right away, they were calling CHIRLA and asking for guidance and what to do. And that's how we were able to connect with our legal department, at least for guidance, right? So that just goes to show how important keeping the hotline open and functioning has been in this time of pandemic.
Absolutely. Thank you. Thank you so much for engaging in that conversation, because I do think it is a really important. Many of our funders, our friends, our partners and supporters, I think it's understand and know, but it's really good to be able to illustrate the compounding of all the challenges that our immigrant communities are having at this moment. So yes, just to affirm what Miriam just said, we are a trusted source in the community and will continue to be. So for my section, getting into a little bit of what the financial impact could look like for CHIRLA and what it means for us to remain responsive, what we need to stay in the space. I think the first point is just to affirm the fact that advocacy and power building organizations like us, like CHIRLA, are going to continue to inform, to advocate, and to protect our community by all means, like we have for decades, especially in this time. Also, I think from what you gathered of what all the colleagues here shared, that we are both a direct service organization, and we're touching, well, technically not touching at this time, but we're reaching out and engaging the communities very closely, as well as working on the big picture advocacy policy work in civic engagement, et cetera. We're continuing to work in both of those spaces, which are both very needed at this time. Now and beyond this crisis, what we want to make sure you are all aware of is that we will need the support in order to protect the infrastructure that has been built throughout the state, throughout California, that many of you have been a part of supporting and making possible. That network and that extension, be it by physical offices that are not open at this time, but the folks that are in place, the infrastructure, the teams that the community is used to connecting with, especially in those hard to reach communities, is absolutely important to keep and to maintain. We will need your help in order to remain sustainable in this time of crisis and recession, what is upon us. We also want to highlight something we didn't get a chance to bring another director in because of timing, but we do want to highlight quickly the fact that we continue to be a convening partner, informing and organizing our partner organizations. So not only are we working with the day-to-day people, workers, families, but we're also providing all of the resources that we spoke about in a lot of these trainings that Miriam spoke about, and the tools for those organizations to also serve their constituencies. So we are sort of remaining active in that way. As it relates to the financial impact for our organization, as you heard from my colleagues, we sprung right into action. We quickly were able to transition into a no contact operation as a result of that crisis response and what is needed right now. Many of our expenses are connected to tech. For example, the HIPAA compliance licenses for Zoom that I believe someone spoke about. We have a high need for high encryption and protection. There have been organizations and different entities that are seeing infiltrations in different places, and we want to make sure that our systems are as protected as possible. So upgrading in that way, upgrading and improving on our website and making certain investments in social media in order to help us conduct advocacy in a different way in this time. I know that Joseph could speak more on that. We've had to, look into purchasing immigration licenses, more immigration licenses for our legal services, and could still do more. As you heard from Miriam, of course, there is an increased demand on our hotline and call center, media efforts, all of the work that we are trying to do just to meet the service gap that there is right now and the great demand from the community. So, all in all, I know you're hearing this from other entities, other organizations, that emergency relief is needed, especially to maintain the investment that you've already made and that you are already committed to when it comes to immigrant communities and disparities that were already in place. So we want to, ask and ask for your consideration of flexible general dollars in order for us to meet those gaps and remain flexible at these times and responsive. We see our service expenses about 50-50 split, going to direct services, which are our legal and community ed efforts, and some organizing, as well as the other half, which goes of our budget, which goes to civic engagement, coalition building, and of course the policy work, which is most crucial at this time in order to maintain those programs in place and get some of this relief aid. That's the expense side. Over on the revenue side, we know that 55% of our funding does come from government grants, and we know that those might be negatively impacted possibly due to whatever happens with that funding and potential differences and changes in our service reimbursements. In likely state budget cuts, which is a reality, and Joseph spoke about. We are watching very closely what the impact of investments to the philanthropic world is going to be. We're not yet sure how that might impact us, but we're looking ahead to that into our 2021 fiscal year, which begins July 1st. And so we just wanted to share some of those points and just to wrap up the conversation about around recommendations for all of you. It would be to please consider or continue to consider pillar organizations doing advocacy in this time of crisis. We know that a lot of relief is being directed and being thought of going directly into the hands of folks, which is absolutely critical and important. But we ask that you also think about the organizations that are sort of impacting systems, educating at different levels of government, and really advocating and trying to raise the voice systematically for immigrant communities. We ask you to consider infusion of general operating support to help us remain flexible, like I said earlier, and also last but not least, of course, engage us in deeper conversations about any one of our particular areas as we move together through these really challenging times. With that, I will move us into the question and answer section. And you feel free to unmute yourself, but also maybe chime in and type in any questions you have in the question and answer section.
I know there might be some questions, but I wanted to clarify that USCIS closed their offices to the public, but most of their work is still continuing. So the only thing, for example, with the DACA application is that they won't have access to the biometrics because they're not, the application assistance centers are closed. But Joseph shared information that USCIS is thinking of using that person's prior biometrics appointment to process that application. So we're hoping and getting more clarification to make sure that that's going to be the case for DACA. The USCIS will use their prior biometrics to process the new application. But as far as we know, even though buildings are closed, everything is still, all the processing still happening through USCIS.
Thank you. Thank you so much, Luis. And I think we have another question here from Christian that might be directed at Joseph. What is the best course of policy action recommended by CHIRLA to advocate for DACA? Is it telling SCOTUS to delay the decision, or to tell the Trump administration to drop the case? Or should we be calling on Congress to prepare legislation in the next COVID-19 bill, depending on the SCOTUS decision? Joseph?
Yes, so a couple of things. So in the House bill that we were supporting, it had a provision that it had an automatic renewal for DACA and TPS. That's something that we will continue to push in the next round of a bill that will come from the House. But I think in addition to that, and Angelica can chime in. I think we've been very consistent since the Democrats took over the House to move a permanent solution for those who have TPS and DACA, and we were very critical in passing HR 6. And so regardless of obviously this pandemic, our hope is that whether we have a good or bad decision out of the Supreme Court, that we press the Senate for a permanent solution via HR 6. And given that there are a couple of bills on the Senate side that will try to deal with those who have TPS and DACA. But as it is right now, we were trying to fix that by having automatic renewals. It was not included in the Senate bill. Our hopes is to include that in the House bill that is coming up in the next few weeks.
And CHIRLA is part of the Home is Here campaign, which has actually launched a request for delay in the decision, given the healthcare crisis. And so that's actually moving forward. And I do believe that we, all of us have to work for legislation that includes immigrants in all capacities. And just for everybody to know, HR 6 is the Dream and Promise Act that included permanent solutions both for documented individual, for immigrant youth, and also for TPS individuals. So that's important for us just to note that both of these populations are in this limbo at this moment.
Thank you, Angelica. Another question, policy is changing daily. How is CHIRLA as a trusted source updating the community of the policy changes at the different government levels?
I'll start by talking about capacity. So what we've been able to do because of the rapid response of policy changes, we've actually increased our policy capacity by transferring over different staff members. So legal department is working with our federal policy and advocacy in order to bolster their ability to both get information, analyze it, advocate. The same thing has happened in Sacramento as well as at the local level. So that talk about how we've actually had to increase that capacity, and I'll pass it over to Joseph to talk about just the rapid response, even to us, I think as directors, how quickly they have to respond depends on a daily basis in terms of what's actually happening, and making sure that we're in the, in the conversation to make sure our community is included.
I think I'll talk more about our role to educate elected officials and how crucial it has been to have additional help. At least, internally, we were adapting. So when the week happened of the pandemic and we had a lot of executive orders coming from the state, but then also at the regional level, but then at the federal level, we didn't have the capacity to, to provide recommendations to some of those executive orders. And so we recalibrated and thank to different departments, we had a little bit more capacity in the last week. And so, but one of the things that we have been doing is based on the survey that Diana mentioned, that we collected more than 1,000 responses, also based on the responses and the concerns that Miriam is hearing from the 1-800 number, but then also for my cases that Luis is referring to. We are trying to collect all that data and stories to then translate that to elected officials about how their decisions are having a direct impact to our community. So on the stimulus package, we were in ongoing conversations with Senate folks and House folks about trying to include our individuals there. But then also with the governor's office, I'm going to tell something that we've been doing a lot of advocacy with the governor, and because we feel the need to continue to have ongoing capacity, things are moving so quickly that even the governor staff at times is not up to date in things that they need to improve. So when they were opening up testing centers, one especially in the Bay Area, given that the federal government is the one that is mostly handling some of those things, the website and the notice indicated that people who were going to that to be tested needed to be citizens or residents and need to speak English. The governor's office did not know about this. We did a lot of behind the scenes work to make sure that that was fixed. And later on, they called us and say, it is fixed. The website does not reflect that people need to speak English, and it does not have the citizenship language there. So we are trying to also be helpful to the governor's office as he is moving forward to be inclusive. And we have been having ongoing conversations with governor staff dedicated to immigrant issues, but then also with budget issues to make sure that any packet includes our community. And we base that out of the stories and the tools that we have available, because we are in touch with our communities, and usually those stories are really relevant at the state and federal level.
Thank you, Joseph. I think there was a quick question with regards to the surveying. Maybe Diana can speak to what the plan is and when we think we might be doing another reach out and another kind of surveying of the community.
Yeah, so when we included the COVID-19 question to 3 days of our contacts, and now the rest of the days, the remaining of the days that have passed by, we're starting off with the COVID-19 just kind of talking point, like how are you doing? Are you staying safe? Do you need access to resources? And so we do guide them to our hotline and then to a website. But I know the organizing team, again, I said this earlier, they're actually going through and calling all of our active membership base to go more into depth about the necessities that they have in their household and as individuals. So the conversations continue to happen.
Thank you, Diana. Thank you so much. And we're coming up on 11 o'clock, or we are there. We want to be respectful of everybody's time. If there are any other questions you would like to type into the box, we will, if you could provide your name, then we will make it a point to respond back, and we'll be sharing this resource, this recording with other folks that were not able to join. Angelica, maybe if you would like to close us out just with the closing message. I would like to say thank you to my colleagues. I think, you know, it's just wonderful to see the round-the-clock work that is being done. They're the advocates, really the unsung heroes in all of this, just staying really close to the community and in switching gears and pivoting and doing whatever needs to be done in order to remain responsive and our community. So I want to thank them for their time and thank all of you for joining us today. Angelica?
Sure. So, you know, certainly this health crisis has demonstrated the inequities in our society, those who have and those who don't. And this is a moment in which it really spotlights the fact that immigrants continue to be left out. But there's opportunity, and there's an opportunity to really push our elected officials at the local, state, and national level to include immigrants, to recognize how critical legalization, immigration reform is to our community in order for them never to be excluded in this way again. But most importantly, I think it's about challenging and really participating in a democratic process in which all the contributions that immigrants provide to this nation also means that in a moment of crisis that they have to be taken care of as well. They're taking care of this nation. They also deserve to be taken care of at this moment. So the last thing I just want to say is thank you for joining us. Thank you for all the support that you give to CHIRLA. And just to say that we're here. We're not giving up from our homes in the most creative of ways. I want you to know that we're innovating as much as we can, as quickly as we can, and bolstering our different capacities in order to respond to our community in this moment. And thank you for responding with us.
Thank you, everyone. Thank you. And we will be in touch. Be safe, everybody.
Thank you. Thank you. Take care of yourselves.